Hey, are you someone who's recently got a root canal done? Or say your dentist has just recommended it to you and also suggested that you need to get a cap or a dental crown after your root canal procedure is done. And you're wondering, what is this dental cap? Do I actually need it? Then don't worry, you're not alone. This is a very fair question, and a lot of people have this doubt. Almost every patient who gets a root canal asks me this question that, Doc, do I really need a cap? And thus, in this video, I thought let me address this issue today, and let's talk more about why we need a dental cap after doing a root canal procedure. But having said that, do you know that not all cases require a dental cap or a crown? There are a few indications where we do not recommend going in for a dental cap. So if you want to know whether you're one of those people and if you don't require the dental cap, then please do watch the video till the very end, because in the last segment of the video, we are going to be discussing this topic. But before we begin and start talking about all the technicalities, let me take a moment to introduce myself. I'm Dr. Upasana Gosalia, founder and head dental surgeon at iSmile Dental Clinic at Mumbai in India. And thank you for all the love and support that you guys have been giving me. My channel is dedicated to addressing some common questions and everyday issues that a lot of you have pertaining to oral and general health. So if you are somebody who's looking for a beautiful smile and a healthy body, then please don't forget to subscribe to my channel and hit the bell icon for regular updates. And to all those of you who already have subscribed, thank you for the love and welcome back to my channel. So let's begin with the first and the most obvious question. What is a dental cap or a crown? A dental cap or a crown is basically a prosthesis which covers the entire dental tooth 360 degrees, okay, all over. It covers the tooth, and this is made up of some artificial materials like ceramics and sometimes a combination of ceramic and metal. And this prosthesis helps not only to restore the form, but also restore and rebuild the function of the tooth. So it plays a dual role to restore the form as well as the function of the tooth that it is covering. So basically what I'm saying is, say if a tooth is very grossly decayed and it has lost a lot of its tooth structure, or it is discolored and say it's lost its shape as well due to the underlying decay, then a cap will help not just to restore and rebuild the aesthetics and appearance, but also restore the function of the tooth and help in its primary function, which is chewing. So a cap looks something like this, and it's typically made of ceramic or a combination of ceramic with some other substances. And we have a wide variety of caps, the selection of which can be done as per your budget and aesthetic requirements. That can be discussed with your dentist as you go along the procedure. Now, this brings us to the next and the most important question. Why is it necessary to actually cap a tooth after a root canal procedure? So firstly, a tooth which is very decayed and it is completely infected, the pulp is infected, which is the reason why we're performing the root canal in the first place. Now, such a tooth is very weak. It has lost a lot of its tooth structure due to decay. There are two main reasons why the tooth which is root canal treated is basically weaker as compared to its non-decayed or healthy counterpart. Number one being the tooth decay itself, the cavity which has led to the infection and the root canal. And the second is the drilling which is required in order to perform this root canal procedure. Now, this drilling is absolutely inevitable if you're looking to save the tooth. If we have to perform the root canal and save the tooth, that means we have to drill in order to access the root canal. We have to ensure there's proper infection control, there's proper sterilization and cleaning. So this is inevitable. It's a part of the entire root canal treatment. But unfortunately, this also leads to a little bit of weakening of the tooth structure which is left behind, because we are taking away some bit of the tooth structure. So yes, this is also one of the reasons which weakens the tooth. So like I said earlier, this tooth which is root canal treated is much weaker to its healthy and non-decayed counterpart. Also, it loses its shock bearing capacity. Shock absorption goes for a toss once the pulp is out. Secondly, it tends to get discolored over a period of time due to the infection which was present earlier. And thirdly, also there's a chance that the tooth might fracture or break when a person is chewing or under pressure. And thus, we recommend that you place a cap on a tooth which is weakened after a root canal treatment so that it doesn't fracture or the filling doesn't fracture at the weakest point, and you can chew all your favorite food and hard food at ease without having to worry about the tooth ever cracking or getting fractured. So don't delay getting that cap done. Please talk to your dentist about it. I usually recommend that at least within 2 to 3 weeks of completing your root canal, you must have placed a cap over that tooth. Or say if you are someone who is still suffering from some post-treatment sensitivity or pain, then maybe you can let all those symptoms subside and go away completely. And 2 weeks after being pain-free and after all the symptoms having subsided is an ideal period for you to start with your capping procedure. So now that we've spoken about why it is necessary, let's talk about what is the procedure or how is a dental cap placed in your mouth. So this entire process is typically going to be divided into 2 visits or 2 appointments at your dentist, wherein in the first visit, when you visit for the first time after completing your root canal, your dentist will make impressions of the teeth and the surrounding structures and your jaws, both upper and lower. And these impressions are further sent to the laboratory where the actual process of fabrication of this cap takes place. Now, impressions can be of two forms. They could either be physical, wherein the dentist will use some impression materials like alginate, they'll place it in your mouth, record these impressions, further pour these impressions that are taken with dental plaster, make a cast of them, and that's how the traditional method used to be. But now, with the latest advances and the entire digitalization era in dentistry, we have been able to eliminate this process of making physical impressions completely. And now we have moved to digital impressions. So, what we do is we use intraoral scanners, which will record your tooth, which needs a cap, and all the surrounding adjoining teeth very precisely and accurately in one sitting itself. And these digital impressions are then sent into the lab where the process of fabrication takes place. Digital impressions have made this entire process so much more patient convenient, patient friendly, more accurate, and very, very easy. So, yes, this is a very big plus point, and you can always check whether your dental clinic offers digital impressions because they are certainly going to be more pleasing than taking physical impressions. So once these digital or physical impressions are sent to the lab will take at least about 2 days to prepare your prosthesis and the cap and send it back to us. Once we approve it, check it, you will be called in for your second dental appointment, wherein the dentist will actually fix the cap onto your tooth with the help of some specialized bonding agents. And then you're free to eat and drink as per usual without having to worry about the tooth getting fractured or breaking under pressure while eating any hard food. So that's all in short about dental caps that I wanted to share with you guys. Of course, this is a very vast topic. If you want to know what a dental cap is actually made of, what are the different types of materials available, what my personal recommendations would be in what type of cases, then please let me know in the comments below because this is a very vast topic, very difficult to cover it in this one single video. But if you want to know more, I will certainly try and make a different separate one for this. So do let me know. Okay, so this brings us to the last part of our video where, as I had said earlier, we will be talking about places where a cap or a crown is not indicated or is not absolutely necessary. So there are a few cases which I would like to highlight. The first one being in cases wherein the tooth decay or the cavity itself is so small or tiny, or maybe a lot of the tooth structure has not been decayed. It was just a little bit, but still the pulp is infected and we need to perform a root canal procedure. But a lot of the surrounding and adjoining tooth structure has been preserved and not decayed. In such cases, placing a cap will do more harm than benefit, because in order to put in a cap, we do have to make and drill out a little bit of your tooth structure. So that would weaken your tooth, which is already strong and maybe does not require a cap. So in such instances, only a very strong resin-based filling material or a restorative material would do for a long term. But of course, the pros and cons need to be discussed with your dentist. In my experience, the most common cases where I have come across with such situations is lower front teeth, the lower incisors, as well as the lower premolars, because the cavities in such teeth tend to be such that we can easily access the root canal without having to prepare much of the tooth or touching much of the adjoining tooth structure. And we can easily do a post restorative build up, and the tooth is just fine to go without having the need for a dental cap. So, yes, do discuss this out with your dentist. And secondly, there are cases which we call it as anterior tooth trauma or ATT. These are cases wherein a tooth has discolored due to trauma from a past injury. It could be a very long standing injury or a short term injury as well, wherein sometimes the tooth also tends to discolor and it looks reddish, purple, or even brownish at times. In such cases, we do require to perform a root canal, though there's no obvious cavity present. What happens is the impact of the injury tends to create a little bit of a shock or a contraction in the pulp, and this leads to damage and infection in the pulp, and thus root canal treatment would be required. But a point to remember over here is the tooth itself is intact. It is not decayed or damaged. It's just that the pulp or the nerve was infected, and thus we're performing the root canal. So in such cases, we recommend not placing dental caps because it would do more harm than benefit, and we would have to drill a lot of tooth. You can opt in for a dental veneer, which is like a very, very thin sort of a dental cap which only covers the front surface of your teeth, so that if there are any discolorations in your teeth, they can be fixed and manipulated, and you don't still have the need for an entire complete dental cap. So these two mostly are the cases where I was talking about, where a crown would not be absolutely necessary or indicated. But again, I would like to stress on the fact that this needs to be discussed and talked about with your dentist. Please weigh your options nicely, take an informed decision. Sometimes you may feel that you can get away without a dental cap, but don't just make that judgment based on this video. Please discuss it out and make sure that you have a strong tooth. So that's it. That's all about why placing a dental cap on the tooth is necessary after a root canal. I hope I have helped you gain a little bit of insight on this. And if there's anything more that you want to know about caps or anything else related to oral and general health, please do let me know in the comments below. And I love to hear from you guys, and I'll try to answer all your questions and as many as I can. Thank you. And as I say always, stay healthy and keep smiling.